Good afternoon, mayors and colleagues. We'll just wait just a minute to make sure everyone gets transferred into the breakout room. Okay, it looks like we have 3 mayors joining us, and then colleagues from ESCAP and Oki from UNU IAS. Good to see you. The mayor from Adu Maldives, Mayor Nizar. I'm not sure we got to meet you last time. Would you mind turning on your camera and introducing yourself?
Mayor Nizar.
මේ මහදාන නෙවෙයි තෙහෙන් තකාලේ මෂවරාක බයිරු අදති පොත ලපාදින් හඳාන නෙවෙයි තෙන් වර කුරින් හිඟ පේටි කම්පයනකම් පේවා කඩනින් කම් මහදාන නෙවෙයි තෙලකම් මෂවරා ලිබිගෙන් දෙන් එනෙල්ලක රයිසකන් ඉන්නේ ෆියෝලෙඩේක දැන් රයිස මිසාලයක member kaga parate hoda kama inne fena kama inne misalaka tertuma kama councilors mashwara ve den LGA tanto viole dan I think inzar dinuma khade kan kama ne
Excuse me, may we ask you to turn on your camera?
Elected me hunna ke khade deka ehen action ne ke bisa makadas councilor ne inzar ne die asma human jeven LGA masale jasaji khade le ke inna kama den WDCs follow kara jena kawa detra me henga
Okay. Mayor Nizar, will come back to you, and hopefully, if I could ask each of the 3 mayors to turn on your cameras so that we can see that you're with us, and other colleagues as well. Okay, I'm asking each of you to start your video, if you don't mind. Okay, so we have today a scenario that we would like for you to work through. I think it's been shared with you in the past, but let me introduce the scenario. And by the way, my name is Kurt Garrigan. I see we have some other mayors joining us as well. I'm Kurt Garrigan. I think I met most of you at the last inception meeting of the Academy, and it's good to join you here again for this scenario. So what we hope to do during this scenario is present to you an emergent crisis in a hypothetical city and ask that you think through what you as a mayor can do to address the crisis. We want you to focus on executive actions, those that are under the control only of the mayor of a community. Okay. So we'll go through the scenario here, and then we'll start the discussion. So this is about an emerging health crisis in a community in which you're the mayor. It is not your specific town. You receive concerning reports of a whooping cough outbreak in your community, which is highlighting the urgent need for a comprehensive urban development response. The outbreak is disproportionately affecting vulnerable populations, including low-income neighborhoods and marginalized communities with limited access to healthcare services. Your city officials are sounding the alarm about the potential for the outbreak to spread rapidly due to factors such as inadequate infrastructure and overcrowded living conditions. This underscores the importance of both a swift and targeted interventions to contain the outbreak and to prevent further transmissions. Your previous administrations or past administrations in the cities struggled to implement effective disease prevention measures, and this has left the community vulnerable with limited resources and fragmented systems which are exacerbating the crisis. The current outbreak threatens to overwhelm healthcare facilities and strain urban infrastructure and your resources, necessitating an immediate action to safeguard public health and well-being. Let me stop there and see if there are any questions about the scenario itself or the circumstances with which we'll be discussing today. Any questions? Okay. So we would like for you to really focus on 3 key questions, maybe 3 or 4. First, which government offices will you mobilize, and who are the non-state actors? In other words, non-governmental officials that will be part of your recovery efforts and addressing the crisis. Second question, what resources would you deploy to address the crisis? And third, maybe most importantly, how will you address the immediate needs and the long-term recoveries? So let me stop there, see if there are any questions on the scenario, and then open the floor for any mayor who would like to start. Remember, this is not what's happening in your specific city. You are the mayor of a city which is facing this crisis. Okay. All right, so the floor is open. If I could ask one of the mayors for your thoughts on how you would mobilize both government and non-government actors to address this crisis. Mayor Nizar, would you like to start?
Good morning. I'm sorry that I had some technical issues that I couldn't join.
No worries.
Meeting from the
It's good to
beginning.
meet you. We didn't get to meet you in the last meeting, so welcome.
Yeah.
Would you like to start the
So
discussion on how
let
you
me
as a
go through-
mayor would address this crisis?
Yes. Having a busy day today, so that when I attended to the meeting was not ready enough, so I had some slight technical issues. So what's there what's there in the agenda? So can you
Yes, so
Get
we're
me-
going through a hypothetical scenario, which is around an outbreak of whooping cough in a community in which you are the mayor. And you are asked to address this situation, which has been exacerbated by previous administrations not addressing health services or upgrading infrastructure. So there is a serious risk of the outbreak expanding across the community. We would like to know which government offices and who and other non-state actors, non-government officials who you as a mayor would mobilize to address this crisis.
Thank you. Here in Maldives, we have the health ministry would be overseeing more health issues, but at the other hand, we have public service division of health ministry, which would oversee such sort of pandemic if such issue comes. As a mayor, what I would do is, if it happens within our city, we will first of all call all our stakeholders, that includes our government hospitals and local hospitals and other related offices, that includes all health sector offices, private and governmental, and also in our city, the securities, the police, and all government offices have to include. During the pandemic, we had a mobilized a task force, which includes all health sector personals and government offices, plus police and M&D if there is security. So that's what we do. So in the scenario that you have mentioned, what I would do is I would call immediately to all these related offices and get them mobilized, and then we'll discuss on what we can do. And also we will bring the attention of the central government and the health ministry regarding it, and we will discuss on all technical issues with the health sector and get their advices on what we can proceed further to prevent it. That's what we'll do.
Great. So Mayor Nizar would contact the National Health Ministry, would establish a task force and mobilize city government departments, including the local health services. Mayor Ghana from Chandragiri, would you add any others to the task force?
Hello.
Yes, please.
Good morning to all.
Who else would you mobilize to address the crisis?
We have some problem in health sector also. First of all, before the COVID-19, during the COVID-19, we have the most problem in our city. At that time, we have no any knowledge about the COVID-19. During the COVID-19, all the health sector, government sector, and community sector, and our municipality sector also jointly effort to the problem solving the problem. So at that time, we moved the community sector. All the community sector we have mobilized to the that sector, and we have also managed for the health sector, officers, health sectors also, and our government sector also. First of all, we have mobilized to our municipality members also, So jointly, government and the community and the municipality members, political members, and the women health workers also. Women health workers. That means the voluntary women health workers also. We mobilized that sector. So we need to available resource that types of our available resource. So we immediately address about this among the crisis. I think in nowadays post COVID-19, we have similarly we have just recovering for the health sector, and we just manage about the hospitals and the ward health posts and urban health posts, like these types of the implementation are doing. And our municipality, we are providing about the community health workers also, community nurses also. So we are taking the data, and we go to the home to home, door to door. So we have managing about this crisis of the first resource. Thank you so much.
Okay. Thank you very much. If I could ask you to be a bit more specific on the community. You said you'd engage community. You did mention volunteer health workers. How would you engage the impacted community, those who are in the vulnerable communities where the outbreak has spread? And let me remind everyone that this is not your own city. This is a scenario where you are the mayor of a different city. Okay, so try not to talk about what you've done specifically in your own community, but how you would address the issue going forward if you were in serving as a mayor in a different city.
Yeah, we have
which members of the community would you engage?
Yeah, first of all, we have ward members, elected ward members of the community. They are doing the community health worker. First of all, we have in wards. We have the 15 wards in our municipality. They have every wards. They have the 7 to 10 persons in health workers, and every wards there near about the 10 persons are the women health workers. That means the voluntary women health workers. So they go to day to day, and in monthly and weekly and partially they go there in the home to home, and they collect about the statistics. So at that community health workers find out in which home are in the health problem, which is the problem that they find out, and they bring us the data, and after then data, when we provide it from the health sector, health facilities, likewise the medicines and hospitality services and this type of services. So these are the health workers, community health workers. And another is one of the health resource person in our municipality. That means the our nursing, home nursing services are also providing in our municipality. That means the one nurses every ward, they have the one nurses go home to home, and they find out what type of the health problem they find out. These are the resources person in our municipality. And community mobilization is also the main problem, and we gathered with in the community level, and they decided about which problem in our wards and sectors, and we will provide the solve the problem.
Okay, so you've added ward or district level, essentially elected officials or representatives. Thank you very much. Mayor Sharma from Mandi, India. If you can turn on your camera and your microphone, please. Can you tell me who else you would add in your response? And again, this is not about Mandi. Please don't mention what you've been doing in Mandi. I want you to kind of remove yourself from your city, place yourself in a new city that has this emerging crisis. What executive actions would you take to bring people together, and who would they be?
Thank you, sir. Initially, what we will do, we'll focus on the self-help groups which we have formed under livelihood program in all the wards. So in every city, there must be a community-based organizations. So initially, we'll try to contact with them so that we can find out some natural leaders out of these community-based organizations. Those can disseminate our messages and can help us to mitigate with the impact of this outbreak. And then secondly, we'll go for convergence with other line departments like public health, water and sanitation, PWD, transport, because they all must have some stake and some impact of this outbreak on their department also. So we'll try to centralize all the planning, all the future course of action, so that everyone should move in a same direction so that the impact of the outbreak can be minimized.
Okay, thank you. So you also agree with the approach of forming a task team or task force?
Yes, sir. Yes, sir. Task force is a basic mandate for this.
Okay, and that task force includes city officials from various departments, as well as representatives from community-based organizations.
Yes, sir.
Okay, great, thank you. Mayor Shahi from Lamkichua, if you could share your thoughts and any other stakeholders that you would engage. Mayor Shahi from Nepal. Okay, maybe we'll come back to her. All right, so the next question really focuses on what resources, assuming that as the scenario indicated, there are limited resources and fragmented systems. What resources would you deploy, and where might you identify other resources to address the crisis? This could be financial, it could be human resources as well. Mayor Sharma, do you want to start? Mayor Sharma? Okay, we'll come back to him. I see he's there. Mayor Sharma, can you hear me okay? All right, maybe Mayor Nazar from ADU. How would you mobilize resources? What would you deploy in terms of financial and human resources?
Thank you, Kurt. These cities in different countries function totally in different ways.
Yes.
Having funds and raising funds, also that functions totally in different ways in different countries. So yeah, here in Maldives, we very much depend on funds that or finance from the central government. In a scenario of such pandemic, we definitely have to request finance from the central government. But at the same time, we also will have our own funds in our council, which we will try to utilize in such an incident. So what I will do is in such a situation is that we will immediately call to the council and we will have a meeting and try to allocate the possible maximum funds that we can manage as an immediate solution to the funding issue. Other resources like transport and manpower, what we will do is we will call upon to the volunteers, NGOs, and groups from other civil society groups we will call and try to get them alert and try to find what source of assistance that they can provide us in terms of human resources or other resources. So we will include volunteers, especially from NGOs, and also to solve the financial issue, we will first try to get funds arranged from our own council, and then we will request to the central government, and we will discuss a forecast budget within the task force that I have mentioned in my previous comment. And within the task force, we will discuss how much budget we may require, that we will forward to the central government and try to arrange funds from them. And transport and other resources, then we'll discuss with other stakeholders and try to arrange such resources from their assistance also. And as I have mentioned, NGOs and other civil society groups will be included and request them to get details of assistance that they can provide us. So that's what I will do in case if such an incident occurs. Thank you.
Okay. Thank you. So what we have there is, as the mayor, you would communicate with the central government to see what financial resources could be mobilized to address the emerging pandemic. And you would also work with the municipal council to either allocate or reallocate local funds to address the crisis. And then also see what the private sector or NGOs could also contribute.
That's fine. Yes.
Great. Okay. Mayor Ghana, any other thoughts from your side on mobilizing resources?
Thank you so much again. We also mobilizing about the national organization and the international organization also. We are taking the resources from them. So they are helping us about from the national organization, likewise the different type of the health organization, and international organization also are giving us the most resources from them, likewise the INFO and the UN Habitat, likewise the other ESCAP, this USAID, this type of the international organization also giving us this type of resources. And first of all, our central government is the fund. Central government fund is the first resources, and province government and the second resources. And our own resources is also mobilizing in our municipality, and the community level also the main resources for this type of the crisis. Thank you so much.
Okay, thank you. So fairly consistent. Let me ask a question that's not yet posed here, but what kind of information, what data do you need to make any kind of decision, again, as the mayor or as the lead of the task force? What information would you request your city departments or others to try to gather?
Yeah, we
in
have
order for you to make these executive decisions, what information would you request be gathered quickly?
Our information is the main of our in municipality organization for the information for the municipality resources are mobilizing in here. First of all, our data is the main resource for the implementing progress. So our community and our resources of our bureaucrats and other type of stuff. Likewise, the PLR project is also running in our municipality from UN Habitat. So the actual data is implementing in our municipality.
Yes, some of that information is longer term, and engagement with international organizations takes a longer period of time. What we have before us is a crisis that you need to address in the next several days or weeks or within a month. What information can you collect to help you address the crisis?
Yeah, our information.
It might be who's impacted, how many people are impacted, what might be the cost of bringing in medical supplies, those kind of questions that you need the answers to address and develop a response with your task force.
Yeah, first of all, in community from the different wards are they are doing the working in the municipality, in our municipality, in the ward members. And first of all, the ward sectors, the bureaucrats, like the administration officers and the teams are doing that types of the working, and they collect data from the wards in the local sector, and they collected the integrated data including the integrated data in our municipality. After then, we finalize about where is the most important to solve the crisis. These are our main wings. After then, we have many sections of the different type of the sections, like the health, economic sector, and agriculture sector, infrastructure sector, like different type of the section are in the municipality. Among them, the sectors give us the data and where is the problem and where is the crisis, and we will decide about this solve the problem.
Okay. Mayor of Mandi, India, Mayor Sharma, is there any other information that you would direct your city officials to obtain for you?
Definitely, sir. We'll try to get information regarding the progress on the health of community, so that it can be monitored regularly and the due measures can be taken well in time. And for the resource mobilization, we just want to add 1 or 3 points. CSR support, we can also go to find out this community resource, corporate social responsibility funds. We have, as you mentioned, that private sector, the role of private sectors can also be ensured if they will be sensitized to provide funds under CSR. Similarly, the funds we have with some religious organizations, those have some charitable trusts, and they can also provide the funds at this epidemic time. So these funds can be utilized for mitigating the impact of this outbreak.
Okay. Any other mayors want to share anything on information that you need to make decisions? Okay. If not, let's go to kind of the last and important question. How will you address the immediate needs? And how will you also start to plan for long-term recovery? Mayor Nizar?
So thank you. In such an incident, we will be getting immediate requests from the public as well as the affected persons or from the concerned authorities. So what we can't be ignoring out any of those requests. We have to value it, and we have to take it seriously. So we within our task force, we will allocate persons who will address on different issues. So once we get a request of such in an immediate action that is required, so we will forward that to the person who is assigned to take the task. He have to attend it. So in our task force, we will be having in charge who have to oversee everything. So that will be forwarded to the assigned person. He have to attend it. If he can't solve it, then it have to come to the superior level, and then it have to be followed. And I think, as I have mentioned before, we can't ignore or skip out any of such requests that have to be taken seriously, and it have to be attended seriously. So we need to have a clear framework, or we will have to have a clear chart of how we will process out the requests. Once we get a request, we have to note it down, and we have to allocate somebody who will be assigned to solve the issue. And we need to get a status of it, how it was being attended, and how much it was attended, and the current status have to be evaluated or have to be reviewed in a timeline that we have given. So that's how I will attend on requests of such a scenario.
Okay.
In a such a scenario. Thank you.
All right. So mayors, as you know, constituents and citizens are not always satisfied with government responses, right? Or the pace of government responses. So assume that you have this task force and you have citizens who are there complaining that you're not acting fast enough, that people are getting sick, that members of their family are getting sick and or dying. What is your response? How do you respond to angry citizens who think the response is not fast enough?
This what I have mentioned now. We need to have a clear view of the request, the state of the request. Once we get a request, we have to note it down, and we have to assign somebody to take the task. In such a this won't be just few requests that we can expect to have few requests. We will have so much of requests and concerns will be forwarded to us. So we need to have a clear picture of the status of the requests or concerns that we receive. Anyone who is in charge of whoever it is, whether it is mayor who is the chairman of the task force, he have to know the status of it. Whatever request that the task force has received, it have to be addressed by it have to be observed by the chairperson or who is in charge of the task force. So that status have to be mentioned, or it have to be shown, or we need to have a mechanism to see the status of the request that we get.
Okay.
And if we can't solve it, then yeah.
Right. And that goes back to the information that you've tried to gather to help make your decision. Let's move now, if we could, to long-term recovery. So what are your actions to plan the long-term recovery, and how do you ensure that something like this doesn't happen again in the future? Mayor of Mandi, Mayor Sharma, what is your future planning?
Sir, will regularly monitor the frequency of that outbreak, how frequently that outbreak can exist. So if the frequency delays, So it means the progress made by our actions is going in a right direction. And if the frequency is higher in the outbreak, so it means we need to have some more actions and clear-cut concrete decisions we have to take to mitigate this and to delay this frequency of outbreak.
Okay, so one of the circumstances in this scenario is that there was long neglected infrastructure. So perhaps, health and sanitation or water and sanitation and hygiene facilities were not adequate. That's something that the city would need to address over a longer period of time. How do you ensure that the communities that are facing this crisis, that are most impacted by this health crisis, receive the infrastructure improvements that are needed, not just the health services?
So for that, we'll decentralize all the plannings and we'll try to go rightly to the grassroots level, and we'll make some IEC campaigns to change and to get the change in the behavior of community towards adoption of sanitation standards, required sanitation standards and sanitation related habits in their day-to-day routine. Furthermore, we'll try to mobilize the resources what we have at grassroots level. For example, we will try to sensitize the ward sanitation committees. So once the ward sanitation committees will be sanitized up to that extent where they can monitor, they can plan and they can execute the plan of actions what we have been making at city level. So in that way, once the course of action is totally focused to get the change at grassroots level, it will definitely help us to overcheck the overview, to get the overview of the whole scenario, to understand the gaps between the supply chain which we have been provided and the community what they have been receiving from our end.
Okay. So some of the information that you've gathered is, which areas of your community are being most impacted and mapped it against where there are infrastructure needs, right? And then maybe you then develop a long-term investment plan based on that. Would that be a reasonable approach? Okay. And then Mayor Ghana, throughout this crisis, you're emerging from the crisis and you realize that the city did really not have a good response plan in place or a resilience strategy to address or prevent some of these more severe impacts. How do you leverage this crisis to build resilience in your community in the future?
Yeah. Nowadays, we have different types of the problem in health sector when the crisis. First of all, there is the non-transferable diseases are increasing in our municipality, like the cancers, kidney damage, heart attacks, heart problems. These types of the non-transferable disease are increasing. That means it will be the problem of the environment and the sanitation, hygienic foods. These are the main problem in our municipality. So air pollution is also main problem. So we must do the further long term for the recovery. We need to the awareness program in community level, and how to improve our air pollution and how to improve our hygienic food habit. Likewise, our children are using the junk food, these types of the foods, and the agriculture sector is also we need to give the awareness program. Likewise, the community need to the awareness program because they're using the uncontrolled pesticides they are using the pesticides. So the uncontrolled pesticides using the vegetables and the agricultural foods are in the most problem in our municipality. So we need to the awareness program, and we need to give the in community level to how to improve our this type of the health problem. We need the main problem in our municipality as this, and we need to awareness program is the most need.
Okay. Mayor Shahi, Mayor Shushila Shahi, are you with us? Can you hear us? Okay, if not, let me go again to Mayor Nizar. So Mayor Nizar, you've again emerged through this crisis. This is a health crisis, but how do you think that your response might provide some learnings for the next crisis, whether it be an economic crisis or a natural disaster?
Can you repeat it, please?
How will you leverage what you've learned and how you've addressed the health crisis in the next crisis, whether that be an economic crisis or whether it be a natural disaster? What have you done to address this crisis that really can then build resilience in your community to other types of crises?
I think for any sort of crisis, the best method that we can apply to solve the issue or to make sure that it won't happen would be to have a proper plans. And also, that's what we have to do. If such a crisis happens, we have to be ready. Prior to such an incident happens, we have to be ready. Even if we are not ready, if such incidents or crisis happens, then what we have to do is we have to attend it, and also in parallel to that, we have to have a proper planning on what we are going to do.
Okay.
In future, also what we have to focus is to have a good mechanism of addressing issues and how we are going to and also allocating tasks to solve the issues. Mostly we as mayors or the whole council may not be technically ready, or we may not have proper knowledge of addressing economic or health issues. We may not be the experts of it. So we have to acquire or get proper advices, proper knowledge we have to collect and apply it in our situation. So to do that, we have to have a well-planned structure within us to address crisis.
Good. Okay. Very well. So traditionally, those would be emergency response plans that are ready for each community, but they've emerged more to become, evolved more to become resilience strategies to build resilience more broadly from across the community to ensure that vulnerable communities are protected, that services are protected, that infrastructure investments are resilient as well and sustainable. I know we have to finish up here in the next couple of minutes and report back. So if I could ask Mayor Nizar, would you mind being the rapporteur, which is presenting back in the plenary some of the key actions that the group here has determined would be most appropriate in addressing the health crisis? Would you mind doing that?
Yeah, no issues, no problem.
Okay. Okay, so we'll leave the room and go back to plenary I guess in just a minute. You should be able to click on the blue button down at the bottom right that says leave room, and that will take you back to the plenary session. Thank you all very much. Very good input.
Thank you, Kurt.
Thank you.
Thanks all.
Thank you, Kurt. Thank you, mayors.
Just don't leave the meeting, just leave the breakout room.